Welcome to From Healthcare Disparities to Health Equity. I'm Kevin Ahmad Jenkins. I'm a visiting scholar in the Annenberg School of Communications, as well as a lecturer in the Department of Biobehavioral Sciences in the School of Nursing, as well as a lecturer within the School of Social Policy and Practice at the University of Pennsylvania. I'll be your instructor for this course. I'm your tour guide, and I'm so excited to be here with you today with Dr. Risa Lavisa Murray, who initially developed the course and whose lectures and original content design and course design we will draw upon as we go through this journey. In the introduction of the course, we'll explain the objectives, and then we'll give you this high-level description of the content. So first off, thanks for being here today, Risa. May I call you Risa, of course. And can you just tell the students a little bit about yourself?
Yes, of course, Professor Jenkins, I'm really happy to be here to help transition this course to you. And like you and many participating in this course, I have experience outside of academia. Specifically, I spent roughly 15 years as the president and CEO of the Robert Wood Johnson Foundation, which is a $11 billion foundation focused on improving health and healthcare and building a culture of health in this country. My goal in the development of this course was to bring that real world perspective to the course and use case studies, policy analyses to explore health equity within the context of population health. Because social factors that influence the health of individuals and populations are critical to discussing and designing strategies for improving health equity. The basic premise of the course is that achieving more equitable health across all populations in our country requires an understanding of the social determinants of health, as well as policy approaches that extend beyond healthcare to include sectors such as education, housing, local government, civic organizations, and private industry. You know, it's well known that there are unacceptable disparities in healthcare outcomes and health status between various populations in this country. For example, the difference in life expectancy between two neighborhoods in a city or region can be as much as 20 years. And many conditions like low birth weight and infant mortality are much more prevalent among African Americans, even after controlling for the mother's socioeconomic status. It's been estimated that the excess care that we give related to healthcare disparities costs our system $30 to $35 billion a year. Now, in order to identify policy approaches to eliminate disparities and promote better health for all populations, we have to examine the problems within the healthcare system, of course, but also the social factors influencing health outcomes and health status, like education and housing and employment. The design of this course is intended to enhance the tools and knowledge that you consider when thinking about innovations, particularly innovative policy solutions that will have a positive impact on the health of populations. Now, my own interest in this area began many years ago with a single patient. I trained at Brigham and Women's Hospital in Boston, but as residents, we rotated at the West Roxbury VA just outside the city. And that's where I met a patient who, in my memories, will always be my lady vet. She appeared at the admitting station late one winter night. She was homeless and helpless and literally brought the cold right in with her. Her feet were swollen and she had on only flimsy house slippers. She had a big raw leg ulcer that clearly made it painful for her to walk. Now, this was back in the day of paper records, and her medical chart was really thick because she'd been to the VA many times before. And we did what we always did. We gave her a few hours in a warm bed, some antibiotics, a decent meal, and then the next morning, We told her, you've got to go because we need that bed for a patient who's more acute. Now, sure, she was a military veteran and had health coverage, but the system was not equipped to protect our patient from the harshness of life. And that harshness was frankly destroying her health and shortening her life. So she limped back out into the same problems that she'd had before: no home, no job, lousy food, cast off clothing, and no social network, no group of people to call her own who could come and help care for her. And we went back to our same old business as usual. The frustration of that day carried a powerful lesson that I have never forgotten. We were up against social, economic, and environmental conditions that were influencing the patient's health. And these factors were winning.
And it's those frustrations that really guides a lot of the work that I do and so many of you do as well. And that is a part of this course. We want to reimagine how the narrative of health disparities actually exists. We want to explore the frameworks of handling diversity and inclusion with care. And we also want to define the contemporary models that really help us to understand equity and inclusion. So now that you know a little bit about us, now it's time to really talk about the objectives of the course.
So let me turn to the content I developed. I relied heavily on reports from the National Academy of Medicine in presenting this material because the Academy is rigorous in applying the best evidence, includes perspectives outside of healthcare, and is very pragmatic in the policy approaches that they present. Many of the disparities that we will highlight in this course highlight differences between Blacks and whites. But in your opportunities for assignments, you'll be able to expand that scope to other groups who also experience health and healthcare disparities in this country.
So overall, the course is divided into really compact modules, each which consists of opportunities to understand and watch lectures and other videos that we've curated. And these will provide exposure to experts in healthcare disparities and health equity. And similarly, the readings are a mixture of original articles and reports, and it synthesizes that literature down as well as helps you to make policy recommendations. The real goal of the reading, the real goal of the viewing of the material is not simply to have you to interact with your colleagues through the online communication. We want to be able to test that knowledge. We want to be able to examine those principles that we're teaching and talking about in your personal as well as professional lives. The lectures are guides, but the real learning will really come from your active engagement and participation with the material as well as your colleagues. And just remember, our ultimate goal is to bring this knowledge in the literature to your real world practical knowledge and bear that on the thinking towards innovative approaches to reduce disparities and to promote health equity. You can plan on spending time to watch lectures and then actively researching and applying the concepts that we have laid out for you so you can bring them to your situation, to your organization.
In the course design, the required readings are kept to a minimum. However, there is a robust selection of suggested readings and videos, as Professor Jenkins just identified, and we want you to use those in your active learning. Ideally, these suggested readings and videos will help you tailor your explorations to areas that are most meaningful and relevant to your professional situations, and then give you the tools to promote health equity where you work and live. Understanding the reasons for health and healthcare disparities are important because, as you can see from this graph, our country spends more than any other country on healthcare, and yet we are far from the healthiest nation on the planet.
And part of the reason why we continue to struggle is really the research has to get out there, and we've got to put the best practices forward. So we had our research team just sit back and look from 1981 to 2016. And we just simply asked one of the most simple things we know how to do, which is similar to a Google Boolean search. We did that same thing within PubMed. And we wanted to know how many articles between 1981 and 2016 confronted racial health disparities, just had the text in that article. Then we wanted to look at how many articles had racial health disparities and prevention as text in the article. And then we also looked at a third condition of how many articles came out that looked at racial health disparities and intervention. And what we see is that there have been a whole lot of articles explaining the disparities, but we're still seeing this movement towards producing the research that actually can look at interventions and prevention. That's where we are. We're here to try to understand a hard problem by continuing to investigate it. Becoming a healthier nation, it requires us to focus on everything, not simply just race, but look at gender differences, to look at things going on in rural areas, to understand how everyone can obtain full health without being disadvantaged by all of the different barriers that actually trip us up, that keep us from health equity. The other thing is being able to truly understand that no one should be locked out because of their social position or their socially defined circumstance. Understanding how to open that door, that's health equity. Now, some of you may want to work in health policy, but even if that isn't your path, a keen awareness of the scope of disparities, as well as strategies to eliminate them and build health equity in communities, that's going to help you. That's going to help you in your job as clinicians, as administrators, business leaders, or whatever path you choose. We're all in a position to use our influence. And as I always like to say, I want to really do good well. And sometimes we have to explain the policies. We have to understand the impact, the positive impact that we bring when we help others. And hopefully this course will help you do just that. So I have to just thank Risa for your leadership, your vision, your mentorship personally. But most of all, we hope we do you justice as we continue this journey. Thank you so much.